All right, first of all, I really am grateful for being asked to be here. It shows how things are progressing in medicine since I started and moved here 13 years ago. What I'm going to try to do today is talk to you a little bit about how complementary and alternative medicine has changed and how it's used now more integratively. When I originally moved to Richmond 13 years ago, I was invited to a conference, and it was called Complementary and Alternative Medicine, and the alternative medicine practitioners were put in one side of the hotel, and everyone else was on the other side of the hotel. And in 2004, I was walking with a friend of mine. She is actually a neurologist at Georgetown, and we were walking hand in hand to a conference, and I couldn't find where I was supposed to go because I'm over in the alternative medicine room, and she's going over to the conventional medicine, and she looked at me and she said, "Honey, don't you know that you're conventional now? Acupuncture is no longer alternative medicine." So what I want to talk to you about is the definitions. What is alternative? What is complementary? What is integrative? What is holistic? You need to be clear on this in the beginning because more and more people are using different types of medical systems, and these terms are being interchanged like it means the same thing. And it doesn't. Alternative medicine, let's see, I'm not very good with machines here. Better with people. If you're confused about the definition, it's because there really is no definition. I was just in Guatemala working last month, and I was there with pediatricians, and the pediatricians were the alternative medicine in Guatemala. So depending on where you are, where you're practicing, the definitions are going to change. Mostly in America, you all practice conventional medicine, and everything else is going to be defined by the practice of conventional medicine. Alternative medicine, what people need to know is alternative medicine is a medical practice that's utilized to replace conventional medicine. You will not see that very often in Chiari malformation. You will not see that very often in syringomalia unless it's misdiagnosed, or you have patients who don't go to the doctors. So alternative medicine, again, I should have gone back. Alternative is an alternative to conventional medicine when someone chooses to come see an acupuncturist instead of seeing a neurologist. Complementary medicine. Complementary medicine is when a practitioner such as I, who is a traditional Chinese medicine practitioner, works in complement with another practitioner of conventional medicine. This is what you're going to see mostly. You're going to see people, or I'm going to see people who come to me with side effects of medications, with problems that have not been fixed from surgery, or just to help out with the surgery. So that's going to be a complementary approach. I'm generally on the phone with their primary care physician, their surgeon, and we discuss a treatment plan conjunctively. Now, that didn't happen 10 years ago, but it does happen more and more now. Integrative medicine is when a conventional medicine practitioner integrates another form of medicine into their practice. So that's when you go to a neurologist who also practices acupuncture, or a neurologist who practices homeopathy, or a neurologist or pediatrician that practices craniosacral therapy, something that would be considered complementary by another practitioner who doesn't have the medical degree. But once you have that medical degree and you start combining treatments, you become an integrative medicine practitioner. Holistic medicine is being used all over the place now, and that's going to give you the most confusion because there really isn't. Everything that we're going to talk about today is specific types of medicine, but holistic is a philosophy, and it's a philosophy of medicine that any practitioner of medicine can use or not use. Just because you see a practitioner of Chinese medicine or Ayurvedic medicine or massage therapist does not mean that they're a holistic practitioner. So we're going to talk about the definition of that in just a minute. But why does this matter? Why am I here in front of you? I'm here because people were spending money on it. So we just have here in 2007, 4 in 10 Americans were using a form of complementary or alternative medicine every year. There were $34 billion being spent out of pocket. The government wanted to know what's going on, and so they started looking, running tests. Let's check out acupuncture. Let's see what's going on. Let's see if it's effective. Let's see how it works. And the main reason that people come for complementary, alternative, integrative medicine is for chronic pain. The other reason is fatigue. And you see, obviously, in Chiari syndromes and syringomyelia, you see a lot of pain. And then from the medications, you see a lot of fatigue. The problem comes is that most patients, 2/3 of the patients, are not telling their doctors what they're doing. When I started practice 13 years ago, people would come in the back door and didn't want to be seen in the waiting room because they were afraid someone was going to come in and see them and see that they were doing something strange. Now everyone's talking about it. I mean, it's in the news, acupuncture, acupuncture, acupuncture. And people were talking about it more, but they're not telling their doctors that they're doing it. And part of the reason why they're not telling their doctors that they're doing it is because they're afraid of what their doctors are going to think of them. I've had patients whose doctors have laughed at them, and it humiliated them. And this becomes a problem when the doctors start seeing results that are not typical of their other results. And they want to know, why are you doing the way you're doing, and my other patients are not? And the patient just says, I don't know. So now that communication is opening up, you're seeing a lot more patients who are admitting what they're doing and leaving their doctors who don't approve or shrug off what they're doing. Money. So again, I want both practitioners and patients to understand the difference between the terms of alternative, complementary, and integrative medicine. Now, there is an American Holistic Medical Association and an American Holistic Nursing Association. This is going to bring us to holistic medicine. Again, any medical system can practice a form of holistic medicine. Holistic medicine is defined as a medical system or practitioner who takes into account the person's mental, emotional, physical, and spiritual well-being, plus its relationship to its environment. So relationship is extremely important in holistic medicine. Your relationship of your body, mind, spirit, your relationships in your family, your relationships to your job, your relationship to your practitioner. It's very important in holistic medicine that you see that there is a function of each aspect of these people. If your mental function is off, mental in holistic medicine is described as the ability to cognize, so the ability to think, concentrate, reason, discriminate. Emotionally, is the person sad, happy, angry, frustrated, and how does that affect their body? We look at their physical well-being, nutrition, exercise, any actual physical issues going on, such as a Chiari malformation. And then, how does the mental, emotional, spiritual, by the way, in the medical practice, is not defined as a religion. It's defined as a person who views that there's much more to life than just limited to them, that there's something out there that's bigger than just the individual. So when we are working with patients, we always look at each of these aspects of person, and then we look at how they relate to each other, or if there are any conflicts in relationship. Do they think one way but feel another? I see a lot of people with neck pain who actually always struggle because they think things should be one way but feel things should be another. And this is an internal struggle that we see in classic papers that can manifest as tension in the neck. We call it a disharmony between the heart and the head. And if we don't know what the patient is going through and help them figure out how to harmonize the mind and the emotions, then we can treat the neck pain in Chinese medicine all we want, but we're not getting to the root. Again, I talked about what's problematic with holistic medicine is, again, holism is a philosophy, and it can be applied to any aspect of life. And when it's applied to a medical system, then we want to make sure that the underlying philosophy of the whole is greater than the smaller aspects of the person are utilized. So there are Western, I know, holistic surgeons, they interview their patients. They ask how they're feeling. They ask about their diet. They ask about their exercise. How are you doing in your relationship with your partner? So, and I know Chinese medicine practitioners who never ask any of that. So don't be confused when you see signs up that says holistic practitioner. Don't be confused that just because they practice Ayurvedic medicine that they're going to be a holistic practitioner. That's not necessarily true. Then there are also whole medical systems. A whole medical system is a system of medicine that usually evolves in a society that has the ability to diagnose and treat a disease. Popular whole medical systems right now are traditional Chinese medicine, Ayurvedic medicine, and homeopathy. So more confusion can come into place because when I see patients who have a Chiari malformation or they come in with migraine headaches, we don't have that diagnosis in traditional Chinese medicine because it's not part of their language. So one of the first things that we have to do as a practitioner, because the Chinese medicine does have a whole medical system, is I have to work up a diagnosis in Chinese medicine. So maybe it's something called liver wind rising. How many people have heard of liver wind rising? All right. I'm like, all right, you have Chiari malformation, you're having headaches, you're having tremors, we need to treat this. I write your diagnosis, liver wind rising. They go to their neurologist and say, hey, my acupuncturist says that I have liver wind rising. I don't have Chiari malformation. Can you see how trouble starts? So they're like, what the hell? What is liver wind rising? Because most of these systems developed over centuries, I mean, some people say it dates back 5,000 years, I don't know, but we at least have 2,000 years of literature in Chinese medicine. When the medical system developed, Ayurvedic medicine is the same way. We didn't have MRI machines, we didn't have stethoscopes, we didn't know what the heart was at the time. So they used functions of nature to describe what was going on in the body. So when you see practitioners of these systems of medicine, what they're going to do is get you to describe what's going on, and then they're going to differentiate that into the language of our medical system. It could be the exact same thing. You say headache, we say deficient qi in the gallbladder meridian of the head. But in their language, it means headache. It just tells us how then to treat the headache, because once you form the diagnosis, then you form the treatment plan. And since we don't have a diagnosis of Chiari malformation, and apparently England doesn't either, then we have to treat within our medical system. Acupuncture is in the press a lot today. And because that is a technique that I practice, it's a little bit of what I'm going to talk to you about. Acupuncture is a part of a whole medical system. It is just a tool that we use. Acupuncture is not the medical system. So when you go see a person who practices Chinese medicine, basically they practice a whole system of medicine in which acupuncture can be utilized. It may never be utilized. Traditionally in China, the acupuncturists were the surgeons. It was a minor form of surgery. Surgeons practiced it. If you had an internal condition, then you went to the herbologist. Now in America, they expect the Chinese medicine practitioner to practice both acupuncture and herbs. But we have a whole gamut of things that we can choose from when we're developing a treatment plan. Again, acupuncture is what's utilized most in America because patients want something done to them. But traditionally speaking, it was the very last thing that was utilized. Before we even utilized acupuncture, we looked at the person's relationship or environment. Are they in the right environment for their body type? We were talking this morning about pressure systems and their relationship to headaches. We hear a lot about feng shui today. Feng shui is not about moving a chair to a specific corner so that you can have more money. Feng shui developed if you have headaches at a place where there's a lot of pressure, move. Simple. The placement of the person in their environment, the environment affects the person. Do you need to live in the mountains? Do you need to live by the sea? Then we would look at diet and food. We would look at exercise. And once we looked at all of that stuff, then the doctor could choose, do we need to treat? And we would treat with herbal medicines. Tui Na is body work. It's like chiropractic medicine in Western medicine. And then the last thing we would utilize is acupuncture and moxibustion. I've seen a lot of Chiari malformation in my practice. Most of it was gone undiagnosed for years, and they just come in with chronic headaches. How do we help, or what has acupuncture been shown to be useful for? One of the main things and the best, I think, use of acupuncture in Chinese medicine in Chiari malformation is we can reduce the amount of medications that people take. We've seen that preoperatively and post, we can reduce the amount of medications needed to sedate. We can reduce the amount of pain medications needed to treat pain, and therefore we reduce a lot of the side effects of the pain medication. In children, a lot of times they're overly sedated and can't concentrate in school, can't function. And once we start acupuncture, then their pain levels go down, plus they're using less medication. Again, we're doing this as a complementary approach, and we always, I think, should work with their physician to come up with a plan together. Acupuncture has also been very effective for neuralgias, dizziness, nausea, fatigue, and depression. One of the first things that people get excited about when they first utilize acupuncture treatments or Chinese medicine is they'll come back and say, well, my pain is no better, my symptoms are no better, but I feel better, I'm happier. And that's the start of the progress, and then we can go further with their treatments. Again, what we're working for is just the overall improvement of the patient's experience, usually with their conventional medicine. We find that when people have their surgeries, come back, still feel bad, a lot of times their experience with surgery leaves them unhappy, depressed, and they start blaming surgeons and start looking for someone else. But if we can actually help and assist the side effects of the surgery, then they actually have an overall experience with the whole treatment of their syringomyelia or Chiari malformation. I'm hoping for effective communication between disciplines in medicine because, again, as we talk together and discuss the different types of medicine, then we can come up with treatment plans together. This is one of the big problems. How do you find a qualified practitioner in alternative forms of medicine? There are places out there to go. One of the big ones is the National Institute of Health. They can tell you, they can guide you to qualified practitioners. It's going to be different state to state to how people practice. It's going to be different state to state to the titles that people can hold. In Virginia, I'm a licensed acupuncturist. In New Mexico, I'm a doctor of Oriental medicine. In New York, I'm a doctor of acupuncture. It's the same thing. Each state calls it something different, so you do need to educate yourself, and the physicians need to educate themselves. Thank you.